Hey everybody, it's Bethany, and I wanted to share my presentation with you all on my topic, which is breastfeeding. So the title of my presentation is called Breastfeeding in America. The main topics on my agenda for my presentation on breastfeeding is going to be the problem with breastfeeding, the demographic affected, legislation, accessibility, current plans to address, and future directions. Since the beginning of human existence, women have been having babies. It's an experience in life that connects people over centuries of time and is universal across every culture, geographic location, and belief system. Throughout history, all women fed and nourished their newborn babies the same way, with breast milk. In the 20th century, however, developing parts of the world began to see a shift from the natural art of breastfeeding to the modern convenience of infant formula. To this day, America continues to have one of the lowest breastfeeding rates in the world. Through years of research, it's been found that America's low percentage of breastfeeding mothers is multifactorial. Within the last 100 years, the role of the mother has changed drastically. Where the stay-at-home mother was once commonplace within society, women began entering the workforce at an exponential rate, establishing themselves as contributors to the household income. Due to an increase in the family's financial dependence on the mother, new mothers have had an especially difficult time obtaining the resources and support needed to allow for adequate time to bond with their babies and establish a breastfeeding system. Johnson and Salpini state that most U.S. women are currently in the paid workforce and unable to take maternity leave beyond 6 weeks, if at all. And when considering breastfeeding and working, women are faced with several challenges: different degrees of schedule control, unequal access to space, and unexpected breastfeeding demands. Additionally, things like time, information, health contraindications, financial constraints, lack of social and professional support, and stress have been recognized as key barriers in breastfeeding success. While breastfeeding problems seem to impact women and infants from all walks of life throughout the United States, the majority of individuals who are the most greatly affected are those who live in low-income conditions, have generally less education, suffer racial disparity, and mothers who are unmarried. These circumstances often prevent new mothers from establishing a strong breastfeeding routine with their babies before quickly returning to work, attending recommended postpartum visits with their doctors, having support from the baby's father in the home, and receiving the appropriate counsel and instruction on breastfeeding at the baby's pediatric office. In addition, cultural norms and stigmas regarding breastfeeding among minority groups have had a major impact on the mother's decision to breastfeed her baby. Without a network of support from family, friends, employers, physicians, the community, and the child's father, there is little hope that the mother and infant will have a successful breastfeeding experience. One of the most significant federal legislative milestones that has served to support the practice of breastfeeding was included in the Affordable Care Act signed into law by President Obama in 2010. The Fair Labor Standards Act of 1938 was amended to require that employers provide their employees with a reasonable break time to express breast milk for their nursing child for 1 year after the child's birth each time the employee needs to. The employer is not required to compensate the employee for receiving this break time, and the employer must provide a place other than a restroom for the employee to express breast milk. If these requirements impose undue hardship, the employer that employs less than 50 employees is not subject to these requirements. Additionally, the Affordable Care Act mandates health insurance plans to cover breastfeeding support and supplies like breast pumps and lactation counseling to mothers who are on their breastfeeding journey. From a state-to-state perspective, all states have laws allowing public and private breastfeeding, and more than half of states have laws exempting breastfeeding from public indecency, laws allowing breastfeeding in the workplace, and exemptions for nursing mothers from serving jury duty. These measures have definitely been a step taken in the right direction to better support breastfeeding mothers and infants. When more of the population gains access to the appropriate breastfeeding education, care, and support, we will see a guaranteed increase in the percentage of women and infants who practice breastfeeding in the United States. For mothers, breastfeeding can contribute to post-pregnancy weight loss, reduce the risk of breast or ovarian cancers later in life, and potentially reduce the risk of developing type 2 diabetes and hypertension. For babies, breast milk is the most natural, complete source of nutrition available. It can help prevent the development of several types of illness such as asthma, obesity, type 1 diabetes, and sudden infant death syndrome. Breastfeeding also allows mothers to transfer disease-fighting antibodies to her infant, which can reduce their likelihood of experiencing short-term illness. All in all, the health benefits that breastfeeding can lend to the nursing mother and baby will ultimately result in less visits to healthcare settings due to a decrease in the development of illness and disease. From an oral health stance, breastfeeding has been shown to have a positive impact on the infant's oral, facial, and occlusal development, as well as some anti-karyogenic benefits during the first year. Recent research says that published systemic reviews show some evidence of a protective effect of breastfeeding against primary dentition malocclusion. And regarding caries, well-conducted studies report a benefit with breastfeeding up to 12 months. The United States government has outlined goals to increase breastfeeding rates in its Healthy People 2030 initiative. There are two primary objectives focusing on breastfeeding for infants: increasing the proportion of infants who are breastfed exclusively through age 6 months, and increasing the proportion of infants who are breastfed at 1 year. Additionally, the CDC indicated on its most recent report card that while 84.1% of infants in the U.S. are breastfed within the first days of life, only 58.3% are still breastfed at 6 months, and 35.3% continue breastfeeding until 1 year. They've designed a series of strategies to improve these statistics, including increasing access to breastfeeding-friendly environments, increasing breastfeeding supportive practices in birthing facilities, providing continuity of care and breastfeeding support, and ensuring workplace compliance with federal accommodation law. Through a continued focus on this area, more women and infants will have access to the breastfeeding assistance they need. Many strategies in place to promote breastfeeding among the population, I see where this topic will become supported by healthcare providers from a multidisciplinary approach. Nearly every healthcare field serves patients who are pregnant, in the postpartum phase, and infants. Breastfeeding education and support can be provided by these professionals, whether they be primary care physicians, pediatricians, obstetricians, oral health care professionals, counselors, therapists, or specialists focusing on a single body system. The more opportunities that patients receive breastfeeding support, the more likely they are to be successful in the breastfeeding experience. As breastfeeding success tends to be strongly related to the amount of support that new mothers receive from their local community, increasing breastfeeding knowledge in the public will also help to normalize the concept and ease the stigma in certain cultures and population groups. While breastfeeding has become a significant public health concern over the last century, efforts are being made to increase the number of women and children who benefit from this rewarding experience. Working, low-income minority women who lack a supportive family life appear to be the most affected by a lack of access to breastfeeding education and support. Over the years, government strategies and legislature have been instituted to make resources more easily obtained to support this cause. As these efforts continue, the goal is for the percentage of breastfeeding women and infants to dramatically rise in the United States. When more individuals have an opportunity to benefit from breastfeeding, our country's public health is sure to experience the difference. Thank you, everybody, for listening to my presentation. I really enjoyed researching this project, and I learned a lot too about breastfeeding and the statistics, and I hope that you took away something as well. Have a great day.